My name is Dr. Richard Johnston. I'd like to take a few minutes to talk to you about the things that you need to know before your total knee replacement. Knee replacement surgery is one of the most successful surgeries available today. Studies have shown that patients get more improvement in their quality of life from knee and hip replacement surgery than any other operation from any surgical specialty. The vast majority of patients who undergo a knee replacement surgery can expect multiple decades of pain relief and increased function from their knee replacement. With modern designs and materials, most patients will never need to face a second replacement. There are things you can do to help your total knee last as long as you do. You should exercise and eat well to control your weight. Every extra pound you carry puts 3 to 6 extra pounds on your knees. You should avoid high-impact activities such as jogging and sports which require extensive running and jumping. After your replacement, you should take antibiotics when you have any dental work, especially cleaning, or if you have a colonoscopy or an endoscopy. I believe that it is very important to optimize your nutritional status before surgery. Studies have shown that patients with higher levels of protein in their system have fewer infections, fewer complications, and they heal better. You will need to start at least 1 month before surgery with a program to increase your nutrition. Most patients undergoing a total knee replacement will not require a blood transfusion. The surgery is performed using a tourniquet, and blood is also collected in a drain after surgery, then filtered and returned to the circulation. Because of this, only 1 out of 10 patients will need a blood transfusion after their knee replacement. If you wish, you can donate your own blood if you start with enough time ahead, or someone in your immediate family can donate blood for you. Red Cross or bank blood is also an option. There's a very slight risk of disease transmission with bank blood. Current data shows that the risk of hepatitis or AIDS from bank blood is approximately 1 out of 500,000. Again, most patients will not donate before a total knee replacement. Before surgery, you will need a complete checkup from your internist or family physician. That physician will need to certify that your medical condition is strong enough to withstand major surgery. As part of the pre-surgical evaluation, you will have laboratory work and will likely need a chest X-ray and EKG. Occasionally, testing will indicate a potential problem that may delay surgery while that problem is evaluated. If you have had heart surgery or have had a heart condition, you will also need approval from your cardiologist prior to surgery. Total knee replacements may be implanted using bone cement, or we may choose a porous ingrowth prosthesis. A porous ingrowth prosthesis has small spaces that allow bone to grow into the back of the prosthesis, which holds the prosthesis to the bone. We will discuss which is the best choice for your knee. You will be admitted to the hospital on the same day as your surgery. You will be asked to come to the hospital several hours before your scheduled operation. During the time before your surgery, you will be checked in, have an IV started, and meet with the anesthesiologist. Most patients undergoing total knee replacement at Missouri Baptist Medical Center or St. Luke's Hospital will have a continuous femoral nerve block placed before surgery. This is a small catheter placed along the main nerve in the front of the leg. Local anesthetics are administered through this small catheter for 2 days after surgery. This has been shown to dramatically decrease the level of pain. The choice of a main anesthetic will either be a spinal anesthetic or a general anesthetic. I prefer a spinal anesthetic as I feel it gives better postoperative pain relief and a faster recovery. You will need to discuss this choice with the anesthesiologist. I will keep your family informed of your progress during surgery and will meet with them immediately after surgery. The average length of a total knee replacement is about an hour and a half. However, the entire time in the operating room is closer to 2.5 hours. Following surgery, you will spend at least 2 hours in the recovery room and will then be transferred to the orthopedic floor. You can expect to have a splint on your leg after surgery, as well as pneumatic compression stockings and support stockings to help prevent blood clots. You will also have a cooling pad over the area of your knee for extra pain relief. Soon after your surgery, you will be started on a continuous passive motion machine, or CPM machine. This device will bend and straighten your leg automatically. It is very important to follow the physical therapy and nursing staff instructions concerning the CPM machine. You will start on your physical therapy the day after surgery. Your therapist will work with you first on getting in and out of bed and then walking. Before you leave the hospital, your therapist will work with you on getting up and down steps and getting in and out of a car. Aggressive physical therapy in the first few weeks after a total knee replacement is very important for optimal results. Most patients can expect to be discharged from the hospital and go home 2 or 3 days after their operation. Those patients who are weaker before surgery may need a short stay in rehabilitation afterwards. Because of federal government rules, rehabilitation in the hospital is no longer an option for most patients, and those patients who need extra care will need to go to an extended care facility or nursing home if required. If you feel that you will need extra rehabilitation after your joint replacement, it is best to look into this before your hospitalization. Before you leave the hospital, arrangements will have been made for home health physical therapy and nursing. A walker, a CPM machine, and if needed, a bedside commode will be arranged. Your home therapist will meet with you 3 times a week, and you will do home exercises daily. Unless I have told you otherwise, you can put your full weight on the operated leg. I will need to see you back in the office in 1 month after your surgery. Please call ahead for an appointment. After total knee replacement, most patients will be able to move from a walker or crutches to a cane in 2 or 3 weeks. Once you are safe on a cane, you can resume driving your car. You can expect 90% of your improvement after your knee replacement by 2 months. However, it may take 6 to 9 months for you to get complete improvement. I'd like to take a few minutes to talk about some of the technical aspects of total knee replacement. Most total knee replacements have 4 parts. A femoral component, which caps the end of the thigh bone or femur. A tibial component, which goes on the top of the shin bone or tibia. A patella component, which goes on the back side of the kneecap. And a polyethylene insert, which snaps into the top of the tibial component. The end of the thigh bone is cut to accept the proper sized femoral component. A square cut is made on top of the tibia and the tibial component is attached. The patella component is attached to the back side of the kneecap. The front part of the kneecap remains your own bone. Here you can see how the individual components come together to make up a total knee replacement. There have been many recent innovations in total knee replacement. One of those that I use is a high flexion total knee replacement.